Thank you, and I now recognize Ms. Simon from California.
Thank you, Mr. Chair and ranking members, and thank you, witnesses, for being with us today. In 2022, we saw the birth of the Inflation Reduction Act, which made health care more affordable to Medicare patients, capping insulin at $35 a month, limiting annual out-of-pocket prescriptions to $200, and negotiating the price of prescription medication, including diabetes and cancer and autoimmune disease. We've been talking a lot about the big and beautiful bill for folks who have battled sickness, and some of us who have battled death right in front of us. We know that what is in the big, beautiful bill, for some of us, we're thinking of it as cold and cruel. Democrats expanded access to essential health care and lowered health care costs for millions of Americans, our elderly neighbors, our community members, and not a single Republican voted for the Inflation Reduction Act. But now, today, Republicans want to pretend that they care. They care about the woman right now who is sitting at Seattle Children's Hospital who had to quit her job because her baby has lymphoma. That baby is dying. She gets Medicaid for herself. Her child is waiting for her to deliver a message that she may have more months. I gotta tell you, this cold and cruel bill, ma'am, these folks don't care about you. You are the able-bodied adult that they're saying doesn't deserve health care. I can go on, and we saw just this week that President Trump said that he would reduce prescription drug cost. And I just want to say, for those of us who have been at death's door with either ourselves or our family members or children, and like myself, my husband, I think we want that. But we know with this cruel and cold bill, over 10 million Americans will no longer have health coverage, and they're not going to be able to see that doctor or get that prescription drug that they so need. That home health care worker, that daycare worker who was able-bodied but is barely making the minimum wage to pay her rent. They don't care about you. This is why any reduction in Medicaid or Social Security, any net decrease, is the difference between life and death for poor Americans. And I'm talking about working Americans. You can't deny it. It's clear. It's clear. And so for those folks who are taking care of your elders and you're only working half-time because you're trying to lift the spirits of the weak, the widow, the sick, the child who is getting chemotherapy at this very moment, there are people who care about you. And we're fighting for you. I have a question for you, Dr. G. And as a disabled American, myself, and a mother who I was a preemie, she took care of me while she went to college. She struggled. We grew up poor. She took care of veterans for over 30 years as a physician's assistant, as an LVN. I thank God for her and so many of others like her who have been fired by this administration. Have mercy on them. But my question for you quickly is, what would cuts to Medicaid mean for vulnerable populations that include seniors? I'm talking about people with disabilities who are now covered by both Medicaid and Medicare. Give me a story.
Sure. The cuts in the reconciliation bill will be extremely harmful for vulnerable communities all across America. About 10% of Medicaid enrollees are seniors. Medicaid is also crucial for providing home and community-based services for disabled people, enabling them to live in homes and get services in the community rather than being in institutionalized settings. The work requirements in the bill are especially worrying. Supposedly, they are aimed at increasing work, but what we really know they do is increase administrative burden, making it harder for people to get coverage. Georgia is one state that implemented a similar program, and in that state, only about 3% of people who would be eligible based on income were able to get through that red tape to enroll in Medicaid. When people lose coverage, it disrupts their care. It means that they might have to discontinue medications, lose access to a doctor or specialist they might be seeing. And it also puts strain on hospitals. Rural hospitals are at risk, as the ranking member Krishnamurthy noted, and it could have repercussions for other clinics in the community for substance use treatment.
Those rural hospitals will close and folks will die. And I apologize to cutting you off, and I want to thank all of you all for being here. And Representative Frost, I apologize. I wanted to yield you time. Thank you, and I yield back, Mr. Chair. Thank you. Thank you all.